I'm visiting with Dr. Jadine Anderson, who is a chiropractor. Dr. Anderson, what about children and infants and the elderly? Are they three groups that are difficult to treat?
Not difficult, but you need to be able to monitor and modify how you adjust them and approach each case specifically, because sometimes a patient that's 2 is going to be needing a different type of an adjustment at a different place than someone that's 30 or someone that's in their later ages in life. So it's very much so case specific to the person, for their age, for their problem, and what caused their problem.
So a 4-year-old might fall down the steps. They take bumps real easily, but they could need an adjustment for that.
Yep, and lots of times younger children or infants respond very rapidly to an adjustment to where you don't need to give them as many adjustments, whereas someone that's a little bit older might need more adjustments over a longer period of time to help them get through their case. Sometimes with the initial trauma that brought the patient into the office will help you decide how often you need to see the patient. So it's